You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Len May, how are you?
I'm great. How you doing?
I'm great. Thanks for coming over and making the time. This is an important interview, I would say, in the episodes that I put out so far, because you're someone who kind of comes from a solid business background into this. So I want to kind of make a little bit of an overview for your career. So do you mind kind of walk us over how did you start? What was the journey and what are you doing now?
Yeah, absolutely. So I'm an immigrant. I was born in Lithuania and I moved to the US when I was about 6 years old with my parents and and my mom's parents, my grandparents too. And once I got a grasp of the language, I would be the kid that would sit in class and a teacher would call me and my mind was elsewhere. I wasn't focused, I wasn't paying attention. And then at some point I became disruptive because I wasn't really interested. So my parents didn't know what to do. So they took me to a psychiatrist and I was diagnosed with ADD, attention deficit disorder. I wasn't hyperactive. So now it's all under ADHD. So I was ADD and I was put on prescription medication.
Your mom didn't take Tylenol, right?
Just now. When it's in her late 70s, she's back on it. So it's interesting because I can't say the medication didn't work for me. If you're just saying it helps with focus, I would say, yeah, it helped to focus, but it removed my sense of self. So there was no, I feel happy, I feel sad. There was none of that. The feeling was numb and dull. So I was hanging out with some older kids before school, and I'm not advocating this for anyone. This is just my story. And these guys were like, hey, do you want to smoke a cigarette? I was like, yeah, cool. I'm going to smoke a cigarette with the older kids. I tried cigarettes before. I don't smoke cigarettes now, but I dabbled when I was a kid. So I never asked them why they had only one cigarette, but they had one cigarette. So they had one cigarette and they passed it around. I took a drag. I'm like, it tastes like a cigarette. So I took another drag and they were laughing. And they ended up putting cannabis in the cigarette. So when I went back to class, the windows that were open in my head narrowed and I could focus again. And I was like, this is interesting. So I gave up the prescription medication and cannabis became my medicine. Illegal, hard to find. I was living in Philadelphia. That's where I grew up. I live in Los Angeles now. So when I would get it, I'd stash it. Don't need a lot, just a little bit. I never told anybody about it. My parents would catch me and they would, I would get in trouble. And then at some point when I was just about 18, my parents called the cops and tried to have me arrested for cannabis. And then one of the cops came in and said, well, if it was my son, I would kick him to the curb. So my dad said, you have 5 minutes, get upstairs, go get your stuff. And he literally kicked me out the door. The irony of this, my parents both consume products my company has patents on now for their conditions, and he's really proud. And so their mindsets switched. But it was interesting growing up in that time and being homeless and going through, staying in motel rooms, staying on people's couches. And I just finished high school and I was going to college and I got a job at a record store called Tower Records, which doesn't exist anymore. But that was my favorite place to get music. And then I started working my way through college. I opened up an internet company. I was going to physical therapy school. I opened up an internet company and exited out of that. And I was going to do music again. So my girlfriend at the time, who's my ex-wife now, said, you have to get a real job. So I got a job at Price Waterhouse at the time and then ended up staying until it was PwC. Did a lot of corporate stuff. And cannabis was still something that was a thread all the way through. And one of the things that happened also, my grandfather who came over with us, he had a stroke and he proceeded to have multiple strokes and in all kinds of different conditions. I'll never forget my parents or my mom and my grandmother sitting at a table with like a shopping bag full of prescription medication. And every month they would be on calls with doctors about contraindications. Well, this is interacting with this. This contributed to this condition. We have another pill. And it was just, and I was scared of it. I was like, well, this is the stuff that's supposed to heal you. That's the one that's actually creating all these issues for my grandfather. So that was in the back of my head too. Fast forward, I did my corporate stint. I decided to do real estate. So I was a commercial real estate broker. created a company, I exited out of that, but it allowed me to move to Los Angeles. And I was sitting in a real estate office, and these guys came in and they wanted to open an alternative pharmacy. It's like, what is that? And they ended up wanting to open up a dispensary. They just didn't want to say it. So I said, that's fine. Where's your paperwork? You have to be compliant with this, that. I was doing research and that. They didn't know what I was talking about. So I said, you know what? I'll help you. I helped them, got them a space, and they offered me a partnership. So I ended up opening up 4 more as a partner under the same umbrella. And what I started noticing was 2 people were consuming the same varietal of cannabis and had a completely different experience. So my ADD kicked in where I hyper-focused and I started researching. I found a video by a guy named Kevin McKernan, who was the first person, or claimed to be the first person, genetically sequenced a plant. So long story, just a little bit longer. I went to work with them, and my job was to travel around the U.S., get plant material from different cultivators, bring it to my lab, extract the DNA, and sequence it. So we started the first genetic library of chemical varieties, cultivars and chemovars of cannabis, and put them in the blockchain for chain of custody. The parent company of Medicinal Genomics, the company that I was consulting at, was called Cortigen Life Sciences, and they did pharmacogenomics. So the study of how drugs interact with your body and drug-to-drug interaction, all those different things. So I really got into human genetics, and I had a light bulb moment one day. I said, we have plant genetics here, we have human genetics here. Let's bring those 2 together and guide people. They really didn't have any interest in it, so they closed down the human side. And I was lucky enough, I found some really smart scientists and started my company, EndoDNA, in 2017. The first goal of the company was to create an endocannabinoid system test. And when we met with the FDA, they said, where's the purpose of the test? And we said to help people either avoid or mitigate a possible adverse event. So we started with that test, and then doctors started coming to us and saying, I have I have all these patients that are female patients that are starting to show signs of perimenopause in their late 20s and early 30s. Is there a way that we can do a genetics test to get ahead of that? So we started a female hormone health test, a male hormone health test, and now we create a platform that's patented as a decision support platform that uses genetics, whole genome, and epigenetics to bookend that experience so we can help healthcare professionals make more informed decisions and maybe get ahead of some of these conditions. So that's the story.
That's very interesting to come from that kind of background to do this amazing discoveries in genetics. But you have a lot of competition. There are many, many companies right now that are doing, more or less the same thing. How do you navigate these things?
Yeah, I don't believe there's a lot of competition. The competition is really with yourself, and it's perceived competition. So companies like the 23andMe's and the Ancestry.coms, et cetera, they're focused on consumers. We're B2B. We're focused on healthcare professionals. That's one. The second part is I was left always with this question of now, so what? Okay, you do a genetic test, you have a genetic predisposition. Now, so what? What do I do about that? And the now, so what part is a treatment plan. So working with healthcare professionals, now that we know your genetic predispositions, there's a scoring system. We use machine learning. We have a patent on that as well that allows us to present to healthcare professionals. These are the biomarkers that you should be aware of when you're making a decision or an intervention for your patient. Not only are we using genetic markers, we're also using blood markers that may be out of range. So now the AI makes suggestions to the healthcare professionals. Maybe perhaps modify dosing, modify method of intervention, and look at drug interaction. Look at all these different things, and creates a treatment plan template for them. They can go and modify. And the other thing that makes us different, I guess, than the rest is the feedback loop. So now that you have the treatment protocol, how do you know that's efficacious? How do you know that it's working for you? And that feedback loop is key because we look at epigenetic expression. So we get baseline biological age, we get baseline biomarkers, if we can see if there's any methylation changes to those biomarkers over time from future tests. Number two, we look, patient-reported outcome, and we also look at changes in biometric feedback. So your wearable device data, all that goes to the cloud, and then we start making better predictive inferences. So the more patients, the more users we have that go through the platform, the AI gets smarter and smarter and says, Dr. Smith, there's 50 patients similar to Len that have taken this protocol. This is our suggestion. And Dr. Smith says, you know what? I like 90% of that, but I don't use a topical, whatever it is, testosterone or whatever hormone optimization. I like to use subcutaneous or whatever. So they're going to modify that treatment plan. Great. The AI is going to learn to see what works better. And that's the platform is a decision support platform Yes, there's a lot of other companies that do genetic testing, epigenetic testing, but I don't think there's a lot of companies that actually bookend the experience and provide a platform for healthcare professionals to help them make decisions.
Yeah, I mean, this is very helpful, and I think it's the forefront of technology right now in medicine. The issue that I see, though, is the um, ability to convince the medical professionals to use something like this, because I have a feeling the resistance is pretty hard. Not because they don't want to, probably because they don't know how to. Is there any educational part in this for them? How do you convert their mindset from treating everybody with statins and whatever, hormone therapy into analyzing specifically individualized treatment plans for different predispositions?
Yeah, I mean, it's an excellent question, and you're absolutely right. I mean, I gave a talk. I'm not a doctor. I don't even pretend to be one. I'm not a healthcare professional. I'm just a sciencey guy who was introduced as an autodidactic polymath. So I just am interested in different things, and I absorb them, and I can kind of talk about complicated subjects in a way that people can understand. But you're absolutely right. Genetics. And when we first, I did this talk to a bunch of healthcare professionals, and I said at the end, anybody have any questions? There's no questions. I was like, okay,
not good.
I must have done an exceptional job, or I did a really bad job. And so I gave out my my number and my email, and nobody asked a question. But then I started getting texts and emails from individual doctors. So one of the things I found out, doctors don't want to look stupid in front of other doctors, in front of other colleagues. So they don't want to ask a dumb question, even though there's no such thing. And I also found out they don't really know genetics that well. So functional medical professionals, integrative medical professionals, they're on it. They've been on it. They're open to this because the idea is we're going to look to see what the symptoms are and try to get ahead of it before they turn on and become an actual disease or a condition. So looking at genetics and looking at genetic predispositions is part of the game. That's what you need to do, is see what. Now, it doesn't mean that you have to take any action on that. It's something to be aware of. And I look at it as a GPS of life. You know where your potholes are on your road, and the doctor and the patient should be in collaboration. They're in partnership to be able to address that. The second thing is that you're also correct about this notion of, is there a tutorial? Is there education? Yes, yes, yes. And there's a lot of that. But the thing that I think is easier for doctors to do is interrogate the genome. And when we put in the interrogation part of the AI, so you can ask, I don't know anything about this single nucleotide polymorphism. I'm going to put an ESR1. Tell me what this is. Why should I be aware of it? What does it do? So once you have that conversation, you don't have to ask those questions. You're asking the AI, and it's telling you that information. So it makes it much easier for the healthcare professional to feel more comfortable with that. And we're not trying to change anybody's protocols. The platform would just highlight the things that you need to be aware of when you're making a recommendation. You can ignore all of it and still do your own protocol. But what we're doing is we're giving you information to help you with your decision-making process. So things like aromatase, like what do you do with that if you have a gene for that? Well, maybe you want to increase the amount of estradiol that you're, or if you choose not to, that's up to you. But the information is there to help you make better informed, precise decisions.
So now going back to your business model, I kind of want to see what kind of strategy do you have into addressing and kind of putting this out for healthcare professionals? Is there any way you make this available? How do they reach out to you? How they can access it? How can people actually use it?
Well, I mean,
the medical professionals.
Yeah, I mean, we have over 250 medical professionals that use it now, and we have over 7,000, I guess 8,000 customers now. So the way that it works, the way that it used to work is we would sell you a DNA test or a number of them. They're a white label for your clinic, for your practice, and then you would log in and check the results in your platform. Now we shifted over to more of a platform, software as a service type of model. So there's a setup fee, which then will create your own personalized report with your own logo, all that information. You would then have your DNA tests. They're also branded for you. So those DNA tests are in your office. There is a buccal swab. You would swab, you register that patient the same way you would do any other test. We're HIPAA, we're GDPR compliant. You would then ship that sample to a lab. takes about 14 business days to get your results. You would log in to the platform. You would see what the results are. Your patient can receive them at the same time. Depends on how you want to set it up. And then you would review the results with your patient. So there is a monthly fee, very nominal, about $99 a month. And then there's a lab fee. So you have your kits. When you register a patient, you pay the lab fee for that, and then you would get your results. So that the business model works like that.
Yeah, very, very easy. I think it's just a matter of perception of people kind of knowing about this and be able to interpret those results. Because I'm more familiar, and I think more people are familiar with the new trend of the methylation tests that are out there. The DNA methylation tests that can help, kind of guide you and go towards the right treatment for different types of genes like that. But what would you say is the most important or frequent application of this?
It depends. I think our biggest selling test is the female hormone health test, followed by cognitive health. We've done, we have 16 citations in PubMed. We've done a phase 2 clinical trial at Harvard. We have two clinical trials that we're doing, one on Alzheimer's, one on Parkinson's. We have 5 observational studies at Wayne State, 3 in Shaman, Montreal, and in Canada, and then one in the UK that we're starting. Also, that one's on female hormone health. So hormone health is really important, getting ahead of that condition. So looking at predispositions to perimenopause, looking at are they a good candidate for hormone optimization, looking at things like if they're predisposed to hot flash severity, what can we do? What are the side effects of menopause that this individual is predisposed to? Same thing with men. And some women are not good candidates for estradiol. Maybe they're looking at testosterone. So you got to see how they metabolize. You're looking to see, are they a good candidate for pellets? What about looking at skin? We have the skin test is integrated in that one. We have an individual skin test, premature aging, or things like eczema predispositions. And if you start looking at holistically the entire body, you're looking to see what types of autoimmune conditions maybe this person's predisposed to, and are they predisposed to having additional stress hormones released? So if that's the case, now you can kind of follow it down the line and see, well, that the release of cortisol is actually turning on the epigenetic expression of gut health or something like that, and that's creating an autoimmune condition. So if I know that I can turn that expression down, I can turn off the autoimmune condition that's being expressed there, which are a lot of times are gut health issues. So yeah, you're absolutely right about methylation, but I look at it this way. If you don't know where your potholes are in the road and you're just turning things on, you may be turning things on that you don't want to turn on. And we've been using genetic testing for 50, 60 years. How many times, you're getting the BRCA1 and BRCA2 for breast cancer genes? It's validated and there's solid science behind that. It's just a matter of, I'm going to put it out there in the universe and see how people respond to this. I think in the United States, we do a fantastic job at acute treatment. So if I have a fracture or I need surgery, I don't want to be anywhere else. We have some of the best in the world here. What we don't do a great job at is chronic conditions over time. And because there's, I go to the doctor, I had this happen to me. I have a pain. All right, you have a pain. Well, we can give you a pill for that, an analgesic, so it'll alleviate the pain, or we can give you an injection. It'll alleviate the pain. And my question is like, what's causing the pain? Why don't we go to the root cause? Well, guess what? I may have a predisposition to stress reactivity. I'm not addressing that stress reactivity. So what's happening is I also have a predisposition to bruxism, which is grinding, clenching my teeth. When I sleep, I'm not addressing my stress, but it's coming out in my sleep quality, which I'm measuring with my wearable device. So if I'm not getting my good theta, my good quality reset sleep, first of all, I'm not excreting as much testosterone, other hormones that I'm producing. There's a lot of things that are produced during sleep that I'm not doing. Also, I'm agitated. So I'm on this hamster wheel over and over and over. How long is that going to continue before my genetic predispositions are turned on epigenetically, and now I'm having these conditions, which one of them is pain in my elbow or my joints, and that maybe has to do with the overactive immune response to the cortisol. So these are the things that we need to start looking at as healthcare professionals, that it's not just about giving you a pill or a shot. It's about looking at holistically, what can we do to prevent some of these things from turning on? I have another really quick example for you. I have a friend of mine, really successful business person, made a lot of money. I did his DNA test before the company didn't. And one of the things that he was predisposed to was depression, depressive states. He had some markers for that. So he had a venture that didn't really go well, according to him, and he became depressed. And he went to a psychopharmacologist and he got an antidepressant. That's what, we do a lot of times. He doesn't live in Los Angeles. He was driving in LA with his wife and his son. And he told me, he goes, I had an overwhelming desire to drive off the cliff. He goes, it was so real to me. I could visualize it. And it was just, this is the way I need to go. And luckily he drove off the side of the road, parked, came out of the car, and his wife's like, asking him, is he okay? And he said, no, I'm not okay. And I should not be driving. So when he went back to the psychopharmacologist, they ended up doing a pharmacogenomics report and seeing that the drugs he was on, or the drug he was on, was red. He shouldn't have been on that drug. Not only that, he has treatment-resistant depression. That's in his genotype, so maybe that was triggered. So that drug wouldn't have worked for him, most likely, but he still had the side effect, which was suicidal thoughts. And I was doing a talk to doctors also, and a psychopharmacologist, et cetera. And I asked him, I said, how many of you do a pharmacogenomics report before you prescribe an antidepressant or anti-anxiety medication? How many hands do you think went up?
None.
Exactly. 0. So that's the point.
I think conceptually, Len, this is a big, very important point here. The fact that people need to understand that in medicine today, the tendency is to treat everything symptomatically with medicine that has been on the market for many, many, many years. Although we know the side effects, although we know the bad effects, I would say. Now you're coming up with this concept of actually personalizing the treatment for each individual based on their actual genetic predisposition, which is a concept that I think it's very important in medicine today. It's revolutionary. And I think more people should kind of get on board with this if they want to have a successful treatment, because you can treat depression for years and years with something that doesn't work. And you end up in, suicidal thoughts or even worse than that. When you can do this type of tests and, very simply know exactly what medicine to take, or maybe don't take the medicine and go to other forms of therapy directly. What is the bigger interest here for you? What do you want to accomplish with this on your largest goal?
It's a great question, because my business partner and I, when we got together, I sat down at like a vegan grill or something like that, a veggie grill. And I remember, I don't know how to program. It's not my forte, but I know how to paint. Like I'm an artist. So I drew on paper what I wanted to accomplish. And I said, and I want to create the world's largest efficacy repository. That's the goal. I was frustrated working with clinical trials and rats and in vitro and all these different things. I said, there's a process, and I understand that. But real world evidence is instantaneous, immediate. So if we can treat data just and anonymized, I'm not looking to market to you. I'm looking to see if we can help people and healthcare professionals try to put individuals in buckets, basically. So there's buckets that you fall into, and you have data, thousands and thousands and thousands of people that have showed that if they have this genetic predisposition, this type of protocol shows that it's more effective or more efficacious. And so the big vision, big goal is to create that data repository and be able to still use this platform for, look, it would be nice if we can have somebody that partners with us that can help us scale. You're absolutely right. One of the things that we're really bad at is getting the word out. We haven't been great at marketing ourselves. We've been so focused on trying to create great IP, great technology, and making sure that it's usable that we never really spend the money to get the word out. So having some sort of partnership, strategic alliance, or maybe even ourselves that helps get the word out, I think that'll be a very good approach for the company in terms of scale, because that's next phase. But it is really data. It is really getting efficacy data. That's sort of the big vision.
Yeah. Let me go back to yourself a little bit. I want to I want to pick your brain and see what made you do what you're doing right now. What was your engine behind your things? Why?
I, I'll tell you why. I've been thinking about this for a very long time, and people talk about follow your passion. You have to do what makes you fulfilled, what you're passionate about. And as somebody that has a superpower of ADHD and is also a polymath, my passion is not singular; it's multiple. So I lean into my curiosity. Something that I'm curious about, I'm going to do. I'm going to work at it. I'm going to read it, or I'm going to start a business in it. And if it fails, I don't even think about it in that way. I think about it, what a wonderful learning experience that I had. I want to move on to my next thing. And because I have the superpower, I can do three things at once instead of hyper focusing. So I was a commercial real estate broker. I worked for a company called Keller Williams, and I was the managing director of Keller Williams Commercial for a while. Gary Keller, one of the founders of Keller Williams Commercial, wrote a book, and it was called The One Thing. And he would come out and he would do these talks about the one thing. I never got it. And it may work for him. And it obviously did, extremely successful. But one thing, I would go crazy if it's one thing. I have a podcast. I'm writing books. I have a book. I do my record of the day. I'm a big fan of music. I have a huge vinyl collection. I'm doing this. So yes, can you do too many things? Absolutely. But I think it's following the things that you're curious about and taking action. Too many people block their own curiosity. They're interested, but they don't take any action because we're creatures of comfort. And it's much easier for us. It's the same thing as you say, man, I need to go to the gym. Once you get to the gym, you're there, you're great. But it's the ability to get your ass off the couch, in the car, go to the gym, get changed, whatever you have to do. It's that, oh, you know what? Tomorrow. And I don't believe in that. I believe in, like, let's take immediate action because I can learn something from that. And as long as I'm getting dopamine, which I'm deficient in, apparently, with my condition or whatever, as long as I'm getting it, that's what I'm interested in. That's what makes me tick.
Yeah, that's a great explanation. And I'm thinking about what they say, right? They say it's not really important what you do between 9 to 5. It's what you do between 5 and 9, like in your free time. How do you use your time to even develop those hobbies and, interests in different things and try new things and go and experiment with stuff, either with businesses or passions or hobbies or whatever you want to do. People get stuck into this comfort zone, like you said, and I think it's a very detrimental thing for evolution in general, in different aspects of life. Have you ever failed?
Fail all the time. You learn way more from failure than you do from success. I don't do well with success. I don't even know how to define it. I'm working through that. My girlfriend's trying to help me through that. Every once in a while, pat yourself in the back and see that I don't really like it, and it kind of comes from childhood. And it came through.
It's funny you said that because you don't deal with success because you deal so much better with failures, right?
But it doesn't even faze me. I allow myself 24 hours to grieve. So mess up, 24 hours, great. Dust yourself off, figure out what you learned from that experience and move on. This too shall pass. It's okay. You're never going to be given more than you can handle. And if you don't push yourself a little bit outside of your comfort zone, you don't grow. And it's the same way that we build muscle in the gym. We tear it, new muscle forms, and it gets bigger and we get more resilient. And I believe that has something to do with, coming from an abusive household, being homeless, failing. I had businesses that failed. I had friends that turned on me, all kinds of different things. And people shooting at me. It's a really interesting upbringing. Came from the streets in Philly. And I think it's the resilience that knows that I can count on me. No matter what, I know that I can count on me and I got it. And it's this notion of there's a balance. Sometimes when I sit at home and I'm watching, some stupid TV, I start having a conversation with myself. What am I doing? I should be doing this. I should be working. And sometimes you have to give yourself some love and give yourself a hug. It's okay. It's okay not to do something. So I'll give you another example. I have a very large vinyl collection. And one day I decided, you know what? I'm going to organize it much better than it's organized. I didn't realize the undertaking. It was just a whim. And then I have to take immediate action to that. So I started taking out wait a second. How am I going to categorize them? How am I going to, what genres? And I started overthinking it. And then how am I going to create the shelves? Is it up and down? Is it left to right? So the first thing I had to do was come up with a system. Once I realized that I have a system and I'm going to do left to right, I'm going to do all in alphabetical order, and it doesn't matter the genre. Now I was, every night. So I think I'm about 1,300 albums in, and probably have about 600 more to go. But at night, I'm going to give myself 2 hours, and I'm going to do that. And this is where you reward yourself. I'm finding a lot of records that I forgot that I had. So while I'm doing this, I'm putting on the record, I'm listening to it, and I'm like, oh, that's a great record. I haven't. So it's that curiosity is being fed, and that dopamine is being hit with those new records.
So Len, if you know what you know right now, and you've done so many things so far, if you would look back when you started this whole thing, what kind of advice would you give to yourself?
The same advice I give to myself all the time. This too shall pass. You'll be fine. And I think we get into our heads that I lost a lot of friends along the journey, and I understand darkness. I get it. And I have some of my own things, but I believe light is the only thing that can get rid of dark. And when you're feeling this darkness, it's okay to feel like that. And I'm not saying, don't get professional help. Absolutely get all that. But do something that's going to kind of shift that. Do something that's going to shed light on that. So my advice to myself is that everything that I thought that I was going to do in my life changed. It wasn't exactly what I thought. The road is not straight. It can be for some people. My parents were 9-to-5ers. They went to work. They worked hard, and they were, professionals. My dad has 2 master's degrees and all that stuff. And then they retired. I don't have that kind of straight line journey. Mine is a zigzag. So whatever you do, it may not seem like it's something that's going to add value, but I'm drawing on things that I did 30 years ago today that I never thought were relevant to what I'm actually going to do today. So all these experiences make you a well-rounded individual. And if you can channel them for anything you're doing, that's the life's journey. And that's my advice to me and anybody else is, doing whatever you're working on. You're given one life. So enjoy it. And you don't have to stick to your, guardrails of, I have to do this. Yes, you have to do this. Try something else as well. And if you fail, go back to what you were doing before. It's okay. Or do something else. So, that's motion is really important.
Yeah, that's very well said. Motion is very important. I picked up a question randomly for you for the end. What is the one belief or behavior in the past 12 months that was positively impacted your life?
I have to learn, and that's why I've been working on how to be more trusting. And I think that's been an extremely positive experience in my life, just a journey. I've had so many things that happened to me where I trusted. I've been divorced, I've been homeless, all kinds of different things. And that level of trust has been extremely difficult. But I came to a realization that if you don't trust, you don't delegate, and you let go of your control over the situation, it's like a weight off your shoulders. And not people that you delegate to, they're never going to do it how you do it, but you have to give up control. And that notion of being able to trust other people, opening your heart, open your mind to those opportunities, that's been an eye-opening experience for me.
Very interesting. So Len, how can people reach out to you, learn more about you, what you're doing, the whole company thing?
Our website is EndoDNA, ENDODNA.com. I'm also on all the socials, Len May, LenMay. I think on Instagram, I'm Len May DNA. If anybody's interested in my music stuff, it's Len May Music, or I'm on TikTok and under Len May. I have a book called Making Cannabis Personal on Amazon. I also have another book on ADHD and polymathy and some music stuff. And so there'll be 2 more coming out shortly. I do a podcast called Everything is Personal. I just love doing that. If I could do that as my full-time, it's the most fun I have because I learn so much from wonderful people. So if you want to take a look at Everything is Personal, it's on all the different platforms.
I appreciate you coming over, and I think people will really treasure this conversation because it's an example of resilience, passion, and trust.
Thank you.
Thank you, Len.
I appreciate it.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.